Thank you very much, Sarah, for such a nice introduction. So this evening, I'm going to briefly present the next slides, I think. Our experience with the collaboration for the clinical and research activities in Asian countries, especially East Asia, and wanted to get some suggestions or comments from you who have established such a wonderful collaboration network, including this wonderful Congress. So, please let me just briefly start from my country. I'm from South Korea. Its population is 50 million. I think it's about 60% of Turkish total population. And the area is such a small country, you know, that I must mention that thank you very much for your help 70 years ago when there was a Korean War in Korean Peninsula. But, you know, still the Korean Peninsula is divided into North and South. And North Korea is still threatening us with a nuclear weapon. And South Korea's area is just 100,000. It's about 1/8 of Turkish area. So it's a small, fairly small country, and is located far east to Asia. You see that geographically Korea is very near from Japan, and China, Taiwan, and so this area is called East Asia. The slide shows that lifetime prevalence of mental disorders in Korea. As you see here, the total mental disorders about the 25 to 30% of the general population, and this is the lifetime. And when we exclude, you know, you see here the huge amount of nicotine dependence and alcohol dependence. Fortunately, they are decreasing. And except the substance abuse, the lifetime prevalence of the mental disorders is about 12 to 14%, and half of the total mental disorders. As you see here, the most common is anxiety disorders, about 8 to 9%, and MDD is about 5 to 6%. Surprisingly enough, you know, that the lifetime prevalence of psychotic disorder, schizophrenia, is 0.5, and that of bipolar disorder is just 0.1. So it means that they are underdiagnosed or misdiagnosed, we believe. And we have a Korean Psychiatric Association that was established in 1954, and we have a current member 4,000, which is, as far as I know, a very similar number of the Turkish total psychiatrist number. And it is increasing annually 120 or 30, and we are publishing Korean and English journals. There are so many about 20 or 30 academic societies under the umbrella of the Korean Psychiatric Association. And we have a Korean College of Neuropsychopharmacology that is the counterpart of the Turkish Association of Psychopharmacology, and also the counterpart of the CIMP, which was one of the earliest society that was established in 1985. And the number of current member of is about more than 300. It also has the annual meetings, spring and fall, and is publishing English and Korean journals. We have a Korean Society for Depressive and Bipolar Disorder that was founded by myself in 2001, and we have more than 200 members, and we are publishing, just began to publish an English journal. And also we have the International Society for Bipolar Disorders South Korean chapter that was established about 10 years ago. Is consisted of the members of the International Society, and currently we have just 50 members, and we have monthly meetings to introducing his or her own researches. We have a nationwide bipolar screening day. That was because that we found that the general knowledge about the bipolar disorder was too low, and that was closely related with low prevalence of the bipolar disorder. So that day is the April 4th. It means, in Korea, 4 means very bad things. So, that March 4th is the worst day of the year. So that is adopted for the bipolar screening day. And we are doing some self-screening and education that is followed by question and answer and also counseling. As soon as we have Korean society, we started to establish East Asian Bipolar Forum. So fortunately, we have a very strong participants from Japan, China, Taiwan, Hong Kong. So we established the East Asian Bipolar Forum in 2006, and we have a forum every other year from 2010. And this area has a very similar cultural background and similar socio-economic status, I can say that. So we are focusing phenomenology of the bipolar disorders and cause of bipolar disorder in East Asian countries, and we are focusing the research on imaging, cognition, physiology, and genetics together. We was very successful to publish a paper on the efficacy of olanzapine in bipolar 1 depression with assist of Marshall Tohen and the Eli Lilly company. And this study was supported the adoption of the olanzapine to get the indication for the bipolar depression in some regions of the East Asian regions. Simultaneously, at a similar time, the psychiatrist in Hong Kong named Guillaume Mack tried to establish the Asian version of the bipolar network. So he was really eager to establish the Asian network, and we were successful to have it formally from 2007. And it consists of East Asia and also Southeast Asia, including the Philippines, Malaysia, Singapore, Thailand, Indonesia. And recently, India and Pakistan joined to ANBD. Still, you can see here we don't have our strong partners in the West Asia, so we are trying to extend the collaboration into the West Asia, and possibly including Turkey. Major activities of the ANBD is focusing the diagnosis and advocacy. So we are developing screening tools. We are gathering and trying to make treatment algorithm of the region. And we are trying to establish the cohort or database of the Asian bipolar patients. And we are gathering the prescription pattern for the Asian bipolar patients. Especially we are trying to make educational programs which is appropriate for the Asian cultures. So it is not only for the psychiatrists, but also primary care physicians and patient and caregivers, and also the general public, because the general public can be the trials patients and caregivers for the bipolar patients. So we have the regular ANBD symposia at the biennial World Congress of Asian Psychiatry. And now the chair of the ANBD joined as the vice president of the ISBD. So formally we are collaborating with the International Society. So this is the list what we had Asian network conferences. And this data was somewhat outdated, but we tried to, survey the basic statistics like this. As you can see here, the Korea, Japan, Hong Kong, Singapore has a similar level of socio-economic development, so they have a very similar number of psychiatrists among general population, and still Malaysia, Thailand, Indonesia has a somewhat under developing status in the sense of psychiatry or bipolar disorder. It is also true for the academic association or activities. And as you can see here, the generally speaking, the prevalence rate of the bipolar disorder is very low compared to the Western countries, except the report from Hong Kong. However, they use the MDQ or hypomanic symptom checklist. That is, not a formal diagnostic tool, but it is a screening tool. So generally, it reports a higher rate for from the general population. Most countries are adopting DSM and also ISBD systems. And still, as you see here in the slide, just briefly, the diagnosis of hypomania is still a big issue in the Asian countries, not only for the Southeast Asian countries, but also for the East Asian countries. And the most big problem is the diagnosis of the depression. Psychotic depression is generally regarded as schizophrenia, and the non-psychotic depression is regarded as MDD. So, the diagnosis of bipolar depression is still very low in the region. And so we are trying to develop and spread out the screening tools in the region together. So the slide shows the major barriers for the accurate diagnosis of the bipolar disorder in the region. So as you can see here, the most problematic is that the lack of awareness of the symptom of the bipolar disorder by the professionals and the lay persons, and also the poor training and education for public and primary physicians. And presentation can be varied from that was described in the textbook culturally, due to cultural differences. And that we do not explore the history of the hypomania when we see the depressed patients. So, that as we have such problems like this, I've described, and also, that mood problem generally is not regarded as a problematic or a mental problem. And also the doctors has some false belief that psychotic symptoms comes from schizophrenia and depression is just a depression. That they do not try to differentiate bipolar depression from major depression. So we concluded that education for the general psychiatrists and primary physicians and for the general public is really important. And we should develop the screening tools and spread out it to the countries. And surprisingly enough, that when we started our effort like this, the diagnosis of bipolar disorder in Indonesia has been increased 10 times. That was formerly diagnosed as schizophrenia or major depression is now diagnosed as bipolar disorder. So that is one of the big achievement what you did for the last 10 years. So the International Society for Bipolar Disorder was established about 20 years ago, and the most members are South and North American and European countries, and it has about 16 national chapters, including Turkey. And society offering not only the conferences, but they have a working group, and the professionals gathered together and do the discussions and make some conclusion and publish it major journals, including Bipolar Disorder, JAMA Psychiatry, and American Journal. And another big, contribution is that the working groups are really eager to raise the young psychiatrists and focusing the education. We have a World Bipolar Day from maybe it was 5 years ago, I think. Originally, as I explained, in Korea we had a nationwide bipolar screening day. Actually, that was initiated by myself, and I introduced that day to the Asian network. And at that time, the chairman of the ANBD, Kyooseob Ha, introduced it to the ISBD, and he himself proposed the World Bipolar Day. And an international society discussed it and decided to adopt World Bipolar Day. It's March 30th. That is the birthday of Vincent van Gogh, who was posthumously diagnosed as having bipolar disorder. So this is another achievement from the regional and international collaborations. So as a summary, as a conclusion, I can say that the achievement for the last 10 or 20 years is that promote establishing professional organization or group in each country and region, and it boosted network collaboration, increased awareness, and also enhanced accurate and early diagnosis, and also disseminated knowledge about the bipolar disorder, and most importantly, the nurturing the next generation. However, that these days we feel some limitations, and or as always, it comes from man and money. The problem is that the international collaboration is mostly depend on the specific personnel. So the problem is that if we do not prepare, or if we do not continue to nurturing our next generation, it is hard to continue the collaborational network. And the problem is that funding, actually it is not easy to get grant for the collaboration or international network from government agencies or research fund agencies. And especially recently, that the pharmaceutical companies are reducing to support such meetings. The other way is to get the membership fee, but that is also not easy to gather the membership fee, which has quite different socio-economic backgrounds and cultural differences. So the members are discussing how to continue the international collaborations in the future, and I hope your valuable and helpful suggestions and comments. Thank you very much.